Penile traction devices are tools designed to place the penis under gentle, consistent mechanical stretch over time in an attempt to remodel the tissue. They are most commonly discussed in the treatment of penile curvature, also known as Peyronie's disease, but they are also used by some men who want to increase penile length. In Peyronie's disease, the erect penis develops an abnormal curve, usually because scar tissue or plaque forms inside the penile shaft. That plaque can cause the penis to bend in a certain direction during erection. Penile traction therapy is often used to help gradually counter that curve by stretching the tissue in the opposite direction and encouraging remodeling over time. These devices are not quick fixes. They are usually worn for about 30 to 90 minutes a day over a period of several months. In most cases, that means somewhere between 3 and 9 months for curvature treatment, and often even longer when the goal is lengthening. This is because tissue remodeling takes time, consistency, and patience. The way traction works is fairly straightforward. The tissue is placed under sustained stretch, which encourages gradual structural change. Over time, the body responds to that tension by remodeling the tissue, allowing it to expand or reshape. It is the same basic principle behind other forms of tissue expansion used in medicine. For men with Peyronie's disease, traction therapy is often combined with other treatments rather than used alone. It may be part of a broader plan that includes medication, injections, or in-office treatment guided by a urologist. The goal is not just to stretch the penis outward, but to apply tension in a way that helps reduce the bend. Newer traction devices are more convenient than older ones, which often required several hours of use per day. With modern designs, shorter daily sessions are usually enough, and those sessions can often be split up throughout the day to make the process more manageable. Now, what if the goal is not curvature correction, but simply making the penis longer? Penile traction therapy is considered one of the safest non-surgical options for penile lengthening. It does not involve surgery, pills, or injections. What it does require is consistency. If someone uses a traction device purely for lengthening, the process usually takes 6 to 12 months of regular use, and the results, while possible, are generally modest. Realistically, most men are not going to gain several inches. A more typical improvement might be around half an inch, and in some cases up to 1 inch. In metric terms, that is roughly 1 to 2.5 centimeters. So while the gains are usually not dramatic, some men still feel the change is meaningful and worthwhile. The most important thing is having realistic expectations. Traction therapy can help, but it is a slow process, and the results are usually gradual rather than dramatic. It is more about small, steady improvement than instant transformation. So the bottom line is this: penile traction devices can be useful for both Peyronie's disease and modest penile lengthening, but they only work when used consistently over time. They are not magic, and they are not fast, but for the right person with the right expectations, they can be a practical and effective option. If you found this helpful, drop a comment and share your thoughts. And if you want more clear, honest, and easy to understand health content like this, make sure to like the video, subscribe, and share it with someone who might benefit from it too.